Welcome to Radiological Hepatocellular carcinoma and ascending colon growth, abdominal emphysema. Start with ascending colon growth. Here you can see the plain scan of abdomen. You will find out we give the patient oral contrast for this patient. We have prepared a oral contrast about 45 minutes after scan. This is the 45 minutes after scan. We will find out properly because of the positive oral contrast. The plan sequence was visualized. The problem of the ascending colon. Here you can see the colon. Here you can see in ascending. This is the ascending colon of the patient. You can see the area of wall is largely dilated or infected. Maybe in this case, for positive oral contrast, the wall thickening of ascending colon was properly visualized for the for the oral contrast. If I convert the image into cornell, here you can see properly, just because lots of my students are not that much experience in CT, so here you can see the wall of the ascending colon is properly shown the area of growth. This is the area of ascending colon. In this, the wall is thickening in this area. Or we go to the next phase. It's a arterial phase. Here you can see the colon was dilated. We goes to the venous phase. We find out the colon of this patient was more wall thickening everywhere. Here you can see it's not normal. I try to find out the appendix of the patient, but it's totally different to find out, just because there is lots of loops. I try to convert the image in cornell image. So we find out if there is anything more information. The small intestine are totally overlapped in this area, so it's difficult to find out where is the appendix. Let's go to the next scan. Here is the नेक्स्ट स्कैन फॉर टुडे. ये हमारा दूसरा स्कैन है. यहाँ में हाँ, दिस इज नॉट टुडेज केस. ये एक एब्डोमेन हमारा एब्डोमेन का स्कैन. यहाँ में देखने से पता चलेगा T2 image में. Here you can see in T2 image the liver largely area was edema or different cell. It's not normal liver cell. Here you can see the difference between normal area and the lesion in this area was brighter hypo in this T2 sequence. It means it's contain more fluid with the normal liver tissue. So in T2, if there is a brighter contrast in any type of tissue, it's contain more fluid or in this area. After that we goes to the next sequence. In T2 we find out there is a lots of ascites in this abdominal area. Here you can see bright area of the abdominal area. Peritoneal mesenteric area, it's called ascites in whole mesenteric collection for that. Here you can see in the liver, outside the liver, the ascitic collection was seen largely, just because the patient liver have a lesion. Here is the difference between T2 and T2FS. In T2 we don't properly identify what is a fat, or if there is a fat, or if there is a ascites. In T2FS we find out the large collection in this abdomen. Here you can see every bright signal in T2FS was ascites. So we find out the collection of this abdomen was ascites was properly visible in T2FS. After that, the next scan is T2 corneal. In T2 corneal we find out the actual size according to the corneal. We will find out the lesion was large in this area. So in corneal we visualize the listen, and we try to find out the CBT, but it's difficult just because there is lots of SITs. Here you can see it's a T1FS sequence. In this sequence we will see the SITs collection. In this area was dark just because it's T1 sequence. So here is the arterial phase of liver. You can see there is a enhancement of this area of hepatic tumor. After that we go to the next phase. It's a portal phase of the liver. Here you can see the actual tumor area in this image. After that, if you look closely in hepatic vein, there is a blockage of hepatic vein, so that the vein was dilated in this area. You can see properly in this area there is a blockage. It's called, I forgot it. Here you can see the hepatic vein was dilated for this blockage. It's called I will find out when I am remembered the point. I will tell. Right now it's not my mind. So it's a dynamic scan that you can see. We can take multiple scan of liver with the reactivation for bead hole, just because those sequence are bead hole sequence. So it's totally focused on patient. It's totally depend on patient. So we prepare the scan with